Welcome to the show. As we all know, in the United States, one of the most exorbitant costs of living for some of us are prescription drugs. So much so that the Maryland Citizens Health Initiative has decided to call on the state legislature to address that financial burden by overhauling some of the laws governing drug pricing. Tom, do you think this is going to go anywhere?
I hope so. We certainly need to address the issue, in my opinion. And I think it should have a chance of going somewhere because the issue isn't so much in the foreground these days, whether you're arguing about Obamacare or anything. The cost of drugs is a very important issue. I was at one of the house parties for Congressman Delaney, and a lot of the questions that were actually raised directly to him were about drug prices by a lady who had been a researcher in the drug field as a chemist and became a pharmacist. It was a wealth of interesting information. And, you know, I think it could have some legs here. Certainly the legislature, as we have it composed, I think something could happen. And this would really be, and I think Brian Frosch, the Attorney General's wheelhouse. So I think it could possibly go somewhere. I certainly hope it does.
Danielle, when we have tried as a government to control prices in the past, sometimes it didn't work so well. Sometimes maybe it did. What are your thoughts on this one?
I think it's more than a Maryland problem. I'm along with you. I'm glad that there's a coalition that's formed, but it's a national problem, and it could be a worldwide problem if, as we talked before about the Trans-Pacific Partnership, drug prices could even go up, after that happens. I think what we're going to see with the way things are trending is that Americans are going to start to flock towards generic drugs.
Where they're available.
Right, exactly. Where they're available, more affordable, and even worse, probably in illegal ways of getting drugs, whether it's on the street or the internet. So if we can combat it proactively, I'm all for that. Good for Maryland.
Henry, there's a possibility that some might link this back to Obamacare. What are your thoughts on that?
I have no idea how you couldn't draw a line between the two. And drug prices prior to Obamacare taking effect, they were skyrocketing. Okay, it's not a direct impact of Obamacare.
No,
where I have an issue is Obamacare is mandating that we all have health insurance. So are we artificially padding some of these costs going forward because everyone's required to have health insurance versus being a little bit more price competitive on the market? I know there's research and patents and other things that involve in getting the drug to market. The research and the expense of doing that has become more of a burden. And it's odd how with the United States healthcare system that it costs more to bring a drug to market than what it does in Europe. Is that because they're leeching off of the US system and our research and they don't have the same type of costs? But they also are getting drugs to market earlier than what we do.
Absolutely.
So those things contribute to the cost of, but when we start to look and we say, well, an EpiPen is $650, that's a little ridiculous.
But you know why this really is? I mean, this could be fixed. The main issue behind is the biggest single purchaser of drugs in this country is the federal government.
Mm-hmm.
Now, according to the laws that were written to benefit the drug companies, the U.S. cannot, as a huge buyer, cannot haggle over prices. Walmart can,
Right?
which is the largest private, person. They actually get CEOs of the major companies, they put them in a room down in Arkansas and let them sweat it out because Walmart can get the best. They can deal. They can haggle. The government can't. It's not a free market.
It proves that we shouldn't have the government
government
dealing with the price on these products.
It proves that it should have some ability to haggle the prices because the government can't.
But who
The prescription drug bill passed under Bush 2 had that provision. And that is the main reason now why drugs are not cheaper, because the U.S. government, by far and away, is the biggest purchaser. It has no say in a free market.
So why didn't we take care of that as part of Obamacare?
I don't know, because of the insurance companies, I suspect.
But they didn't bother reading it.
Who?
all the people that voted into it. So that someone could have slipped in that
This
provision.
was back in 2004.
But his
This
point.
was during the Republican
his point. Yeah,
administration.
but his point is nobody read Obamacare, which we're not going to rehash that.
No.
But
We're
the
talking
reality
about drug
is
prices, and that's why they're expensive.
right. But the
It can't be
reality
fixed.
is, if that's an issue, Danielle, shouldn't that have been addressed as part of the?
I'm sure they
America-
tried.
Yeah.
I'm sure they tried.
And think back to the last time you had to go to your physician for not feeling well, and they write you a prescription, call it into your pharmacy, you drive through the drive-through, and you have no idea what it's going to cost
Right.
until you get there. And
Yeah.
so that's another issue for me is, how much is going into these companies' production and research and advertising
much.
and their profit.
Right.
Not much into research. This lady worked for one of the drug companies. She's in her 60s. She had lots of experience, and she had chapter and verse. And she said, it's not the research that's a red herring. Really, when it comes to the actual prices, it's more the inability. There's not a free market here in the United States, and we cannot like haggle or get them from Canada and places. It's not a free market.
Should we
That's
shorten the
basically it.
patent range
I was going to say, it
on?
could take decades
on
to
yeah,
get through the
formularies?
FDA.
Well, and the other,
Yeah, but
the
that's
oth-
not their
but,
problem.
But the other reality is, we do have the Food and Drug Administration, and I know we can probably all find complaints about the Food and Drug Administration, but at some level they do keep us safe, because we used to do things like bloodletting and other barbaric
Oh,
practices.
no, they do. One of my
in
friends
the
just
name of
retired
medicine.
after 42
So
years. from
you know,
the
I,
FDA.
I'm not.
High up.
I understand that there's a big hurdle in the United States to get a drug to market.
But it's not a bad thing.
But is it a bad thing? And sometimes maybe it is. Sometimes there are things that maybe should be fast tracked, and that doesn't happen.
But that's not why some of our drugs cost 10 times the amount, literally, of other places in other countries. That is not the main reason.
But we also have some drugs which are life-saving drugs that
should be inexpensive.
that should be inexpensive,
Yeah.
and they're being sold into other lands that can't afford them, and they
Right.
have no health coverage, and we're raising the rates 10 to 20 times what we pay here stateside, which I think is price gouging
Yeah.
the world.
Yeah.
And I don't begrudge a company making a profit, but I think some of the damage
They
that
make
we
absurd
some of the
profits,
damage
usually.
that we have is that we have too many mega corporations that control so much of the market that
I totally agree.
Yeah. And again, as America gets more tech savvy, I think you're going to see these things being sold illegally and online.
Well, they already are.
Which could be
They
a
already are,
problem
but it's
too.
going to increase.
I
Like
can
with bogus
remember
fake
yeah.
drugs.
I
They're
can
Sure, yeah.
remember back several years ago, before the spam filtering on email was so good, that I would get 15 or 20 emails a day for various drugs, none of which I even took at that point.
Yes.
But I can't tell you how many offers for Viagra and what's the other one, Cialis.
that's your internet
and,
tracking history catching up to you. there, Jim.
Probably is.
Your profile tells them you're going to need these or something. I don't know. They're just starting early to plant
I get them
the
too,
seed, you
so
know?
don't worry.
Well, heck, I'm the senior citizen here. So I should know better than anybody. But,
So one of the things that the Pharmaceutical Research and Manufacturers Association, one of the things that this group wants to do is to have the drug companies disclose their cost basis
Yeah.
Right.
for drugs. Is that a good idea? I mean, you're in business, Danielle. Do you want to give away your secret sauce?
When I go to pull up into the drive-thru or go in a pharmacy and all of a sudden my prescription or a medication I'm picking up increased in cost, yeah,
But I
wanna
don't
know.
think that's what they're talking about. I think the cost. Okay, so
They are.
yeah, they are talking about that. So,
Yes.
so if it's an increase in cost, and that
plus
is a
profits,
problem.
it's the whole.
But here's on Danielle's point. There's a certain prescription for a family member of mine that $650
Yeah.
is what the price is. But when we show our insurance card, 1 month I can go in, it will cost me $2. Another month I go in, it will cost me $25. A month later, it could cost me $100 because that price fluctuates and depends on what the insurance pays. But as far as the manufacturer sharing their cost of goods and cost to bring it to market, I think that's
And
really
their
something
profits.
that is not good for a free market economy.
Well, there's not a free market in drugs. That's the whole point. That's the point I'm making. It really is not.
And
when
Tom?
the biggest buyer by far cannot actually, haggle over it and actually do negotiations on the price, you got a problem, a big one.
So call your Congress people and your
Yes,
senators.
that's the whole point.
got
That's
it.
why somebody like John Delaney wants to address that.
And you're going to get the last word on that next up on the flip side. We'll weigh in on what might be coming to the Chesapeake Bay. We're back in 3 minutes. Stay with us.